Good afternoon, and thank you for joining us on the program Healthy Living on Independent Television. I'm Adesu Wausawaje. Do you know what sepsis means? Do you know the signs and symptoms? Do you know why people get this disease or infection? All you need to know about sepsis is what we want to look at today, how to identify it and what to do, particularly for those of us who do not like hospitals. Sometimes we fit everything, other times we run to the nearest chemist, and before you know what is happening, you're plucking 1, 2, 3, 4, 5, 10 leaves in your compound and cooking because you don't want to go to the hospital. Hear me, when you finish watching this program, you will know that once you have anything, any small thing as tiny as it can be, that is different and making your body act different or making you feel somehow, you will run to the hospital to see a doctor. So joining me to discuss sepsis is Dr. Ibefere Omwage. She's the Senior Registrar in the Respiratory Unit of the University of Benin Teaching Hospital. And so she's going to be talking to us today on this topic. Hello, Doctor.
Thank you for having me.
Yeah, thank you for finding time to be with us. It's so sad that we lost a doctor. Dr. Mrs. Eregie, former Commissioner of Health in this state, and it's so sad, you know. When I got that news, I was like, anyway, may God rest her gentle soul. A pleasant woman, if you know her, if you have met her, if you have talked with her. She's very pleasant and very accommodating and accessible. Well, it is what it is. Let's pray for longevity and take our health serious. All right, doctor. Sepsis. What is sepsis?
Okay, so I would like to make it as simple as possible so we can all understand.
Please do.
Sepsis is a major life-threatening complication of an infection. Now, what happens in sepsis is that someone can have an infection from any part of the body. It can be a wound, an injury, it can be a chest infection, pneumonia, it can be infection in the brain, meningitis, it can be infection in the kidneys, the bladder, the urinary tract, so we call it urinary tract infection. Now, when these infections are on, normally the body has some soldiers, like some form of defense mechanism in which it tries to curtail infections, even without treatment. So when these defenses get overwhelmed, the body tends to produce some chemicals which ideally are to help curb the infection, but in turn those chemicals now start to damage other parts of the body. So when it affects other parts, for example, if the infection comes from the chest and some of these chemicals start to affect maybe the kidneys, the brain, the person starts to have some changes. And then at that point, we know that this is more than it should be.
It should be. Because
it has gone way past just an infective process. It's now sepsis. So it's a systemic response to an infection, and it's life-threatening usually.
Okay, what are the signs and symptoms? How can one recognize sepsis? What are the signs and symptoms? You know, when you have a fever or when you have malaria, of course you know the signs and symptoms, you know. But what should one look out for? Because I read something on the net that gives me some shivers. A woman just had a set of twins, and then everything was okay. She got home, and hours after, she was like started developing all kind of funny symptoms. She couldn't move her limbs, to the point that her limbs had to be amputated. Wow. Legs, hands. You know, when I saw the picture, and she was just trying to hold the twin after her recovery. She spent quite some time in the hospital. And I thought it good for us to come and talk about sepsis. You know, so what are the signs and symptoms?
Okay, so like
judging from the explanation you gave.
Yes, so like I mentioned, there's usually a focus of the infection. Now, I'll use an example, maybe someone that has an infection on the foot. So let me just give an example. A diabetic person who has maybe hit his or her foot against a stone, and then there's an injury. Now, initially, that injury may not be, most injuries are not infected yet, so ideally the body should heal. Now, because of the diabetes, the reduced immunity, the wound may not heal as it should. And then when the wound starts to develop maybe pus, it starts to become toxic. That's the, to use that word,
Toxic,
it starts to
yeah.
become toxic. Now, the body, the infection can spread from the foot to other parts of the body. So those chemicals, like I talked about, that the defenses produce, actually now start to affect other parts of the body. So instead of just having pain in the leg and everything there, the person starts to breathe fast. The person starts to have low blood pressure. The person starts to maybe get dizzy. For some people, they even, especially in the elderly, they start to talk out of point. You know that those chemicals are getting to the brain.
To the brain.
So they can have irrational talk, irrational behavior, or even just unconsciousness. If it gets to the kidneys, they can have acute kidney injury. The kidney may not be producing enough urine as it should. So all these are signs. But like I said, the person may not necessarily have a chest infection, but starts to breathe fast. By the time it comes to the hospital, we examine, the pulse becomes very fast, the heart starts to beat faster. All these things are just signs. So at home now, once you notice that I can't breathe well, but I have an infection somewhere, or you notice that your relative is becoming more dizzy, drowsy, obtunded, those are signs that that infection is getting towards that level of sepsis, and it can be very, very severe.
You know, sometimes we don't really know how to interpret what is happening to children, babies especially. Is it possible for children to have sepsis?
Oh, yes. In fact, that just brings me to the people that are at risk of
Okay.
sepsis. First of all, the age greater than 65 years.
Okay.
Then children less than 5. In
Age
fact,
greater than 65 years
yes,
are at risk.
are at risk because they are, so in these two extremes, for children now, at least less than 5 years, or infants and babies more, then pregnant women, patients that are diabetic, those on chemotherapy. For children, their immune system is not as developed as others.
Yes.
So fighting an infection will be more trivial in them. For the elderly people, their immune system is not as strong as those within the normal middle age. And then for pregnant women, of course, all these groups of people have more lower depressed immunity compared to others. So that's why they are at risk. And those who are at risk of sepsis, by the time they have an infection, it will not be easy to curtail that infection. And one other problem is, which is common to many of us, is the use of antibiotics.
Okay.
There's this practice we have a lot in Nigeria. In fact, we are trying to phase away from that because it's bringing a lot of resistance and then making treatment more difficult.
More difficult.
So you may just have a headache, abdominal pain, then go to the pharmacy and then you're given antibiotics to take. Now, those antibiotics, in advanced climes, they will not give you antibiotics till they do investigations or culture
Really?
investigations. Yes, that's the ideal. You should actually get proper culture results to be able to tell that, okay, these antibiotics for this purpose, to avoid resistance, because by the time you now finally get to need the antibiotic, it may not be effective, and then sepsis becomes very difficult to manage. So that's one practice that we need to actually try to drop. Instead of just knowing, oh, I have a urinary tract infection, I'm going to take so and so drug, it's better to test, get appropriate culture results, sensitivity results, and then treat accordingly.
Okay, so what manifestations should we see in children before we run to the hospital when it comes to sepsis?
Okay, so I'll give the commonest feature infection. A lot of children come down with their chest infection, pneumonias. Now, sometimes the child may just be coughing at home. Instead of going for proper investigation, we decide to watch. Now, ideally at those times, especially for children who can, maybe children who can talk, because a lot of children swallow their saliva, yes, so it's difficult to culture saliva, or for those who are having problems with urinating, or maybe telling you, I'm feeling some peppery sensation when I urinate. Ideally, things like that should be handled in the hospital, not to just be watched, because the longer that infection stays. So if a child is complaining of maybe something in the abdomen down, and then suddenly you're noticing the temperature starts to skyrocket. The temperature is not just coming down, the respiratory rate just starts to become so fast. The person is breathing so fast, then the person starts to get very tired, person is being very restless, not communicating well. All these are signs that that child should be in the hospital.
In the hospital.
Because sepsis is already coming into play. And when it comes to the hospital, most times, from investigation, we see that the white cell count is either very high or very low. So when it's very low, you are so sure that at least the soldiers are not necessarily present enough to even fight infection. So they cause more harm in such situations.
So how common is sepsis?
Okay, so sepsis is quite common. In Nigeria, in fact, using my own hospital as an example, we see a whole lot of cases because it's a tertiary center. So most people go to other, they seek care elsewhere in private places before finally coming there. So by the time they actually come, in fact, they are already very, we use the word septic. The person is having very high temperature. For an elderly person, the temperature may be very low. Body may be so cold, the person may be in shock. What we mean by shock is that the blood pressure becomes less than 90/60. And even when you give fluids, normally, you know the response when the blood pressure is low, give drip, it doesn't respond. You know that person is in septic shock.
Wow.
So it's basically antibiotics and other supportive care needed. So it's quite common, I must say.
So how do we avoid death? Because I know that some persons survive it, most people don't.
Okay, so to avoid death, first of all is to present early, because the earlier the better. If a person presents early, you know it may not have gotten to the extreme of maybe, of course, having septic shock, and then you know that will eventually result in death if not taken care of properly. However, it's advisable that when you have an infection, a known infection that has a focus, you investigate properly. If there's an injury producing pus, we should not just take it trivially. You can culture that sample. If it's a urine infection, it should be cultured. Now, to prevent it, for some people, of course, this is also a bit common, although it's reducing. We call it post-abortal sepsis. So young people...
What's that?
Okay, so young people tend to have these manual abortion mechanisms not done properly. So they try to expel the child manually. And then instruments may not be sterilized.
Okay.
The person may not, the content may not be completely evacuated. All this can result in sepsis at the end of the day. Of course, infection, which would finally result in sepsis. And when that results in sepsis, it's more difficult to treat. So things like that should be avoided as much as possible. Present early. If there's an infection, if there's a chest infection that can be, and where samples can be cultured, they should be cultured. Sepsis is managed in the hospital, not at home. So it's better managed in the hospital. Proper investigations should be done. It should be managed in the hospital, not at home. So once the signs are seen at home, maybe you're even trying to treat somebody at home and the person is not getting better, the person should be taken to the hospital, and not to just keep trying different, oh, I've tried this antibiotic, this one did not work, let me try another one. No. Person should be presented to the hospital.
It's common, as you have said, but is it contagious? Is it something we should be scared of, you know?
Okay, so...
Like, can you get it from somebody? I don't get it. Is it contagious?
Sepsis in itself is how my body responds to an infection, and how it gets worse, or how my body, basically a response. Now, infections can be contagious. Some can, of course, infections can be contagious.
Yes.
But sepsis in itself will not be contagious, because you're not really focused on, yes, you want to treat the cause of the sepsis, but the sepsis itself is just a body's response. Like the fever is a response to some of those chemicals in the body that now affects we call it the thermoregulatory center, where the temperature is regulated in the body. It makes it to now start misbehaving. Person starts having fever. So that fever means high temperature. Sorry, I want to just correct that notion, because a lot of people come to the hospital and say, I just treated fever. Fever is not malaria. Fever is a symptom. It just means your body is hot, your temperature is high. So this fever, the high respiratory rates, low blood pressure, and confusion, all these things are not things that can be transferred to another person. But the infection can be transferred. So if somebody is septic, we still want to curtail
That
spread
person.
because there's an infection causing that sepsis. So you want to prevent that infection from being spread. Not necessarily that the sepsis itself will spread to another person. It's the infection you want to prevent.
Okay, you know, like we live in an environment where we don't really have this culture of seeking medical service as fast as we can. Thank God we have emergency numbers now that you can use to call for ambulances if you're in Oredo, Ego, and Kubaha, okay? So you can use those emergency numbers to call for an ambulance. But where there is no doctor, what is the first aid treatment a person suffering from sepsis, from the definition you gave us, and of course the signs and symptoms we should look at for? What's the first aid we can give to the person?
Okay, so supportive care at home can include use of tepid sponging for the fever. Okay. You can actually tepid sponge the person till you can get help, or you give paracetamol basically to just curtail fever. But whatever you are doing, the person has to get to the hospital. There's no catch. It's not like an emergency treatment that will just make the whole situation turn around. No. All those supportive care, basically, if the person can tolerate orally, the person should be well hydrated, take a lot of fluid. If the person is having fever, tepid sponge, remove clothing as much as possible. Don't just cover up. Then, of course, with the respiratory rate, if there's access to oxygen and the person is having a low oxygen level, if you can check, if you have the wherewithal to check, yes, the person will benefit from the use of oxygen where necessary. Otherwise, the person should be in the hospital.
Okay, while I was doing my little research, I was like trying to check who is more affected, the male gender or the female gender.
Okay, so
when it comes to sepsis,
it cuts across. We use more of the age.
Okay.
We use more of the age to assess. Basically, age greater than 65, less than 5, children and the elderly. Actually, for male to female ratio, our studies have not really shown that it's commoner in women or men. We know women have more health-seeking behaviors than men. But it's basically the age that we use, and then the risk factors, those underlying illnesses.
Okay, let's talk about this woman that I saw on the net. You know, she actually had her limbs removed, both hands, both legs, and I was like, what kind of sepsis can just do so damage to a woman?
Okay, so for somebody like that,
she became paralyzed. She couldn't use her hands and all of that, you know, and she just gave birth. So I'm like, could it be birth related?
Well, it may not necessarily be birth related. It may be an infection an organism that was so aggressive at that time. And then this sepsis can also affect the blood system. So for some people, they can have these coagulation problems. I think I read about that person. She had problems and now had ischemic limbs. So blood was no more flowing properly to her limbs. So that's why they had to be amputated, because they became gangrenous. By gangrene, it means that they became infected. So the sepsis, wherever it came from, had spread to those areas and they became infected. So that infection would have kept ascending. And if she wasn't amputated, it would have ascended till it actually killed her. So those are some complications that can arise from sepsis. Like I said, sepsis can affect the blood system, affecting coagulation. For some people, they have these problems with bleeding. They can have what we call DIC.
Okay.
So they start to bleed and bleed and bleed. In fact, that's what kills a whole lot of people. So just basically from all those, like I said, the chemicals that are being released can affect any part of the body, from the brain downwards. So one has to be very careful. And that's why I said it's managed in the hospital, because for someone with sepsis, we keep monitoring the liver function, we keep monitoring the clotting function of the body, everything. You keep monitoring the oxygen level, you keep monitoring how well the body can retain oxygen. We do arterial blood gases, we do different things to just monitor and make sure that the person is in check. And when there's sepsis, we don't just focus on that particular cause anymore. For example, we had a patient who had sepsis following appendicectomy. So actually, before the person came to the hospital, the appendix had ruptured, went to a private place, they treated the person, and I think there was something, the person just had pus in the abdomen. Now, by the time the person came to the hospital, there was obviously sepsis, fever was very much there, And then this infection started spreading to other parts of the body. She also developed a pneumonia. She also developed urinary tract infection. So it became like a whole multi-organ thing. So we had to assess other organs. So like I said, if it's affecting if the person is having a high risk, you want to check you want to assess everywhere, culture as much as you can. You won't just focus on that particular place. Culture other fluids to help in care. So it's a hospital management.
So what are those things we should avoid now as we conclude?
In conclusion, we avoid the things that lead to long-lasting infections. So if you have an injury that is not properly healing, you should actually go for proper dressing so that it doesn't get infected and cause problems. If you have a chest infection, you seek care early enough. If you decided to, maybe take a medication at home to see if you get better. If within 48 hours you're not getting better, you should actually seek further care. You want to avoid unsterilized procedures as much as possible. So traditional birth attendants should also be taught to sterilize properly, because some of these problems come from poor sanitary wares, the use of poor sanitary wares for procedures. Then basically seek early health care. That's just it.
Okay, Dr. Befiri, this is where I say thank you so much for educating us this afternoon. All right, people, you've heard it all. Should I say more? No. We'll see you again next week. Bye-bye.